I'm David Hammerstein. I represent the Commons Network, which is a European NGO that generally works on the knowledge commons. And I am here today because I defend academic freedom in the medical field, which is seriously under threat by commercial interests, by the enclosure of medical knowledge and the corruption of medical science against the interests of public health. The Cochrane collaboration has shown that when strong commercial interests of the pharmaceutical industry are under threat, whether it be with psychiatric drugs or mammography screening, or whether it be on opening up the data on HPV vaccines, they are vulnerable to pressure against scientific freedom to the point of expelling one of its founding members. And this is not acceptable. And along with 3 other members of the Cochrane board, after this expulsion that was totally unjustified without any reason given, we decided to resign from the Cochrane board. And our fight for academic freedom, for autonomy, for open access, open data, and for medical research that responds to real social public needs, that fight goes on. I would advise people to have a longer, larger viewpoint when a doctor gives you a medicine. Be fully informed about possible harms, fully informed about alternatives in your lifestyle, whether how you live, about what you eat, and especially be fully informed about the combination of different medicines. Surprisingly so, many medical professionals, the source of most of their information is filtered by the pharmaceutical industry, which has a contradiction. The more medicines and the more expensive they are that are prescribed to the patients, the more money they make. And this is often, not always, often not in the best interest of patients. Biomedical innovation, we have to look at the source of the problems. Is the research independent? Is the choice of what we are going to research, what molecules, what medicines we're going to research, is this responding to the needs of the majority here and around the world? Or is it just responding to the needs of stockholders, of shareholders in big companies who want large profits? Is the information about this medical research being shared, all of the clinical data, is it open or is it secretive? Is it enclosed by commercial confidentiality rules? Is it protected by patents? Will the results of these research be, if they're turned into medicine, be affordable universally around the world? Or are they going to just make enormous profits for the company and be enclosed for maybe 20 years or over 20 years while millions of people are dying with lack of access if the medicine is useful? Or on the other hand, will the harms of the medicine be kept secret when a medicine has many more harms than benefits? It is happening today. And these harms will be kept behind paywalls, copyright, patents, and the information will be searched. So what we're talking about is a wasteful practice, a practice where over 80% of medical research is wasteful, and it's unethically repeated with clinical trials on patients that might be harmed just because of the commercial interest of the companies. There are alternatives. There are alternatives to delink the medical research from the pricing and the selling of medicines. There are alternatives of open source medical research where medical research, medical data, and the whole public health endeavor is a common good. It can't be enclosed, and it could be for all of humanity. We have to demand that public investment in research, which is massive, in many cases it's the majority of the research is public money, reverts back into the public good, so with not being enclosed by patents, by copyright, by high prices, and that the state and its research has to move towards public civic partnerships, or sometimes majority public, minority private partnerships, so we could have open medical research and we could bring out medicines at a much cheaper price from the first day. We need to protect whistleblowers. People who dare to challenge the paradigms, the dangerous paradigms supported by industry, need to be protected and not victimized like Peter Gotchi has been victimized.